Are some Democrats actually hoping that Obamacare will fail? That question tonight as we learn that recently Senate Majority Leader Harry Reid suggested that sooner or later America will have to eliminate insurance companies altogether and go to single-payer health care, like the system in England. Single-payer is basically, imagine Medicare for everybody in the whole country. But Senator Reid was not the first to bring this up. Watch.
I'm all for a single-payer system. Eventually.
If I were starting a system from scratch, then I think that the idea of moving towards a single-payer system could very well make sense.
I have supported, when I say support, signs in the street, advocacy in legislatures, and I have supported single-payer for longer than many of you have been since you've been born, than you've lived on the face of the earth. So I think, I have always thought that was the way to go.
What we've done here with the Obamacare is a step in the right direction, but we're far from having something that's going to work for.
So eventually, though, you think we'll work beyond the insurance system?
Absolutely, yes.
Work beyond insurance, yes. Joining me now, Betsy McCoy. She's the former New York Lieutenant Governor and author of the book Beating Obamacare, Your Handbook for Surviving the New Healthcare Law. And Leslie Marshall, who's a Fox News contributor and a radio talk show host and supporter of the law. Welcome to you both for being here. And so the president back in 2003, before he was the president, said very clearly that he happened to be a proponent of single-payer, universal health care. Since he's been president, he's qualified that by saying, if we were starting from scratch, I'd be in favor of that. So he's modified it. But you hear Harry Reid saying this just in August. And the question is, Betsy, as we see the rollout suffer so many problems, whether some who backed the law initially may be hoping that this thing doesn't do very well because the next step might potentially be single payer.
Well, the best evidence is the law itself, the text of the law, which pushes the nation very far towards single payer. First of all, it vastly expands Medicaid, which is single payer health care for people under age 65. Secondly, the plans in the exchanges are actually Medicaid plans with fancy private labels slapped on them. They're one-size-fits-all government-designed plans that pay doctors and hospitals as little as Medicaid pays, which is why if you sign up for one of those plans, you're likely to have to give up the doctor and hospital you prefer. Thirdly, like single-payer health care, this law empowers the federal government to dictate how your doctor treats you. Section 1311 puts the Secretary of Health and Human Services in charge, empowering her to impose regulations on all doctors and hospitals and barring insurance companies from paying doctors or hospitals that don't obey. So a regulation could be when cardiologists use a stent or bypass. And finally, I'm going to get Leslie in, but just move that binder to the side because it's blocking your microphone, I think, a little bit, Betsy. But I want to ask you while you do that, before I get to Leslie, why? Why would they want single payer? Why would Barack Obama and Harry Reid and Nancy Pelosi, why would they all want basically Medicare for everybody or Medicaid for everybody? That's for you, Betsy. They want it because they want perfect equality. They want to bar people from buying more health care, even if they can afford to with their own money. That's ideological. And most importantly, they want to make sure that the government controls our lives. That's why the third point I made was so important, that this law already allows the government to dictate how doctors treat even privately insured people who have paid for their own health care plans. And finally, like all single payer, they give special privileges to one class, government officials. And that's why in August, President Obama weaseled that special subsidy for members of Congress so that they can have the gold plan paid for by taxpayers.
Okay, go ahead, Leslie.
Well, first of all, our members of Congress, our House, our Senate, our President, have always had great health care that was provided for by the government. And that's exactly what they want for the American people. The same with Medicare. Basically, they want Medicare for all because, quite frankly, it would have been easier to implement. And secondly, it's actually a program that has been very, very successful. I have never seen a senior at our medical center give up their Medicare. As a matter of fact, they prefer it and they choose it.
Do you think Medicare is better than private insurance, than private insurance that employers offer at a younger age in this country?
Well, for some, yes. It really depends on the plan that the corporation is offering.
But that begs the question about whether the American citizenry, want to give up private insurance to go on something that's run by the government. That's not really what we were told this was going to be about. I'll let you finish your point, Leslie. Go ahead.
I don't feel that this is what it's going to be about. I mean, if you think about it, socialized health care in Great Britain has been around since Queen Victoria. I don't believe we're going to see a complete socialized system in this country in our lifetime. We have a very different setup in the United States, especially when you look at wages and the difference between rich and poor in our society. The people who are very wealthy have always been able, and I believe always will be able, to find private insurers. But when you speak to who dictates your health care, Betsy, you know this, there are bureaucrats and failed physicians who've been sued so many times they can't get jobs anywhere, working at top private insurance companies, making those determinations for physicians today, just as the government makes them through Medicare.
But, Betsy, I know you have a lot of points to raise in response, but I do want to ask this, because we talked earlier in the show about the fact that the numbers aren't there. They are not getting the enrollees that they need to make this system work. They need 7 million by the end of March. According to the research firm, so far they've got 129,000. And according to our numbers, if that's true, according to this research firm that's been cited by all news organizations, then by the end of March, they should have about 1 million. They need 7 to make the system work. So, Betsy, what does that mean? I mean, where will that take us in March?
It's clear that, contrary to what the president said in his Rose Garden speech today, this is not a good deal for most Americans. It increases premiums for men, 99%, doubles them, increases them for women on average 62%, and young people get clobbered the hardest. As you pointed out, those are the people they want to sign up. But a young man is not going to sign up for a plan with a $3,000 or $5,000 deductible. He's not going to ever get anything back from that plan.
Well, that's the problem, Leslie. And so many are looking at these numbers saying it's not this grand conspiracy that they set up the website to fail so they wouldn't get the numbers and then we'd all have to shift over. But is it an opportunity for those who have been backing single payer to say, you know what, you're right, this didn't work out that well, we didn't get the numbers, so why don't we come up with a new solution? And here it is. It's the one we've been pushing for all along.
Although that might be a great idea, it would be political suicide. It would cost the American people so much more. It would hurt the president and his legacy in this landmark legislation. I think only if this plan succeeds can they say, you know what, let's take it a step further. This was the watered down version of what we originally had. Now you like it. Now you trust us. This is what we've got for you. Here's plan B.
Because if it fails, if the current version fails, what are the odds of the American people turning around and saying, you know what we need is more government running our health care? Betsy, the last
they're not going to like that. They're already realizing that if they sign up for these exchange plans, they're not going to be able to use the doctors and hospitals they currently rely on. People in California have learned they can't go to Cedars-Sinai Hospital in Los Angeles or any of the University of California hospitals. Here in New York, they've been told they can't use New York Presbyterian if they sign up for most of these plans. That's the most fundamental promise the president made, and he was lying.
All right. I got to leave it at that. You guys, thank you both so much. We appreciate it. Betsy and Leslie, all the best.
Thank you.
And in a developing story tonight,